Good morning, it's Mrs. Conlon recording live from Stottsburger Mommy Campus PM program. This is for NUR 100 Fundamentals of Nursing. Today I'm going to demonstrate your physical exam, head to toe assessment. So I would just ask you to follow along on your competency sheet as always, okay? This competency starts out as all competencies start out as student in uniform. For this competency, you need a watch and your stethoscope and your pen light and that's your hands, gloves. That's about it. So I'm going to start with my CG wipes. Check orders, especially for assessment. Do you need to add in anything? A neuro assessment, a full skin assessment? Is there anything that specifically the doctor is looking for? So check orders, gather supplies, again, stethoscope, the gloves, the pen light. That's not too much equipment. I'm going to wash my hands and I'm going to introduce myself to my patient, Washington. Washington. Hi, I'm Miss Kathy. I am here to do your physical assessment. Can you tell me your name and birthday? Yes, Susan Smith, and her birthday is July 1st, 1969. Great. And I see you have allergy band on. What are you allergic to? You're allergic to penicillin. Okay, but we're just here to do your physical assessment today. So I've identified myself, identified my patient, provide privacy with the curtain, explaining the procedure. This means I'll be shining a light in your eye. I don't have my pen light, you guys, so that's my best. Shining a light in your eye. I'll be touching your heart. I indicate where I'll be touching the patient, listening to your heart and lungs and tummy. Do I have your permission to touch you? And the patient gives permission to touch. You must get permission to touch, otherwise that is battery, touching without permission. So I've explained the procedure. If at any time you feel any discomfort during the procedure, I would want you to let me know. The patient says, great. And then privacy, safety, bed down, call light, and reach. Now, this part of the competency, I'm just going to state what my normal vital signs are. 120/80 is the blood pressure normal, less than 120/80. Pulse 60 to 100. The respirations 12 to 20, relaxed and regular. And temperature 98.6. Approximately, and then I would ask the patient on a pain scale of 0 to 10, 0 being no pain, 10 being the worst pain you have in your life. Are you having any pain right now? No. Okay. Then I'm going to go ahead and do some state, like my patient history, my patient's chief complaint. I already found out their allergies. What medications are they on, and what's their stated height and weight? And that is just a stated height and weight. And then are they, now I'm going to state for my examiner the techniques I'm going to use. I'm going to use auscultation, which means I'm going to use my stethoscope to listen to the patient's heart and lungs. And then I'm going to use palpation, looking for roughness or smoothness, equal warmth. And then lumps and bumps. Palpation, also looking for lumps and bumps. Standard palpation is like 1 inch, and deep palpation is 2 inch. And for deep palpation, we would have the patient lay flat. We're actually looking for the edges of the organs, like the liver. Okay. And then observations, you can make a lot of different observations about your patient. What's their speech? Is it rapid or halting? What's their posture? What's their gait? What's their general appearance? Are they well groomed or disheveled? What's their affect? Are they aware what's going on in the environment? So those are just an odor. These are all observations you can make about your patient. And just like their body, how is their body shaped? Because this can be a big indicator for different diseases. Okay, so I've got my observations, and now I can actually move on to my actual assessment. Okay. So I'm actually going to set my patient up. Since my patient does not talk, I'm going to answer for my patient. Okay. You may use a family member. I encourage you not to use a child because they don't understand how serious this is, and sometimes the children get up and run around during the procedure and things like that. You comfortable? You warm? Okay. So we'll wash the hands. I will put on gloves for different parts of this procedure. Generally, though, you don't need the gloves on. Okay. So I'm going to start out kind of checking out my patient's level of consciousness. Now, I've asked them a lot of questions, and they responded promptly and appropriately. So I'm going to say my patient is alert. And now I'm going to ask the orientation questions. Can you tell me your name? Susan Smith. Can you tell me today the month that it's in? It's June. Can you tell me where you are at the hospital? And can you tell me what brought you here? That's called circumstance. You have a bad cough. Okay. So patient is oriented ×4. And then I'm going to tell the patient, I'm going to be shining a light in your eye. And if at any time this would cause you discomfort, then I would need you to let me know. Okay, so for this patient's eyes are not normal. Okay, I'm going to pretend for purposes of this normal head to toe assessment that the patient's eyes are normal. So first, I'm going to shine the light in the patient's left eye, and I'm looking at the left pupil. Now I'm shining the light in the left eye, and I'm looking at the right pupil. I'm going to do this again. I'm going to shine it in the patient's right eye, look at the right eye, shine it in the right eye, look at the left eye. I'm checking to see if both pupils do what one does. This is consensual response. Then I'm going to go ahead and say, keep an eye on this without moving your head. Follow this all the way out. Follow this back in with your eyes. Perfect. That is accommodations. Okay, the pupils will change. It goes out in. While I have my light out, I'm going to go ahead and check out some things. I'm going to look at the whites of the eyes. The sclera, are they white? The conjunctiva, are they pink and moist? Is there any drainage or crustiness in the eyes? All normal. Now I'm going to look at the ear. Does the patient have any hearing aid, any breakdown behind their ear? No, they do not. Okay. And then I'm going to look in the nose. Make sure no nasal septal deviation or any drainage, no. Then ask the patient to say ah. You can use a tongue depressor at this point. I'm actually looking in the patient's mouth. The patient wears dentures. The mucous membranes, you may wear the gloves for this if you like. Mucous membranes are pale and dry. There's no lesions. Okay. So that is the head is done. Now I'm going to do the neck. So for the neck, we're going to pretend the patient doesn't have a trach. I'm going to feel the carotid pulse. I'm going to feel the carotid pulse one at a time. It is 3+ strong and regular. If you like, you can have the patient shrug their shoulders. That's fine, but it's not on this competency. So head and neck is good. Now I'm going to do trunk. So for trunk, first you observe the trunk. Okay, keeping the patient modest. I'm going to observe the trunk. Make sure if there's any scars or rash. Sometimes the first indicator for an unusual kind of breast cancer is a change or orange peel in the skin. Then I'm going to just gently palpate the skin, make sure if there's any lumps or bumps. And if you do find a lump or bump, right now is not the time to say anything. Make note of it and make sure, talk to the patient later. You know, maybe they have fibrocystic breast disease or something like that. So no lumps or bumps, no abnormal skin on the chest, on the anterior chest. So first I'm going to use the bell of my stethoscope and listen to the patient's valves. So starting on the patient's right side at the second intercostal space, I'm going to listen to the aortic, A to man, A for aortic, second intercostal space, left sternal border, P pulmonic, fifth intercostal space, left sternal border, T tricuspid, fifth intercostal space, midclavicular line, mitral, M, mitral. All the valves are clear. I'm going to turn my stethoscope to the diaphragm, listen to the apical pulse for 1 minute. Now, you really don't have to listen to the apical pulse for 1 minute, just state that. I'm going to say that heart valves are clear, heart valves are regular, the apical pulse is strong and regular at 80, okay? And now I'm going to listen to the anterior chest. So I'm going to identify the fields for my instructors that I'm going to be listening to. Tracheal is above the clavicle, bronchial, bronchovesicular, and then down here at about the bra line is vesicular. We never listen over close, okay? So my instructions for the patient is every time I have moved my stethoscope, I'd like you to take a deep breath in and out through your mouth. So deep breath in and out. Deep breath. One more time. And then last on the vesicular. And you notice I go side to side, comparing one side to the other. Vesicular. Okay. So that's about in the armpit, about where the bra strap is. Okay. And then while I'm doing the lungs, I'm going to go ahead and do the posterior lungs. I just like to do it all at once. Okay. And then, sorry about that, guys. Let's see if we can switch it around here. So the same thing, I'm going to listen. Here's the patient's right side and left side. And I know that it's 3 and 2, but I like to listen to 6 so I don't get screwed up. So I just listen. Take a deep breath in and out through your mouth, in and out through your mouth. Take a deep breath, deep breath, deep breath, deep breath. Okay, lungs are clear, all fields. And the posterior chest was without abrasion, and you saw me rub my hand on it. So the back, we had no lumps or bumps. I forgot to do that first though. And now I'm going to ask the patient to lay down, if they can, as flat as they actually can lay down, to examine the belly. Okay, so trunk is done, head and neck. Okay, so we're moving down. Students always ask me, do I need to do the head to toe assessment in that order? And it is best because then you don't forget any area, and that's why they call it the head to toe. So you have a really good method, solid method. But on the flip side, if you forget something, go back and get it. Don't just leave it hanging, okay? Now for the abdomen, if you like to wear the gloves, that's also fine. I'm going to go ahead, keeping my patient privacy, expose the abdomen. Just like every other, I have to make an observation. The abdomen is flat, non-distended. I'm going to auscultate before I palpate on the abdomen. If you palpate before you auscultate, you'll make bowel sounds. Okay, so we just want to hear what they are. I'm going to start in the patient's right lower quadrant. I'm listening for 5 to 20 clicks and gurgles per quadrant per minute. I just move it from right to left. So I'm actually just following the large colon, okay? And then I'm going to gently palpate, and then I'm going to watch the patient's facial expression. If there's ever any pain or grimace, I would stop. So I would ask the patient at this time, how is your appetite been? Any nausea, vomiting, or heartburn? Are you voiding okay, urinating, passing your urine? And then how's your bowel movements been? Good, normal. And when was your last one? This morning. Great. Okay, so the abdomen is fine. So if there's no genital urinary issues, you don't have to specifically assess that. I do kind of do a sneak peek as I pull the gown down. Sometimes patients aren't aware. Maybe they have an odor or drainage, and then you would need to evaluate that. So the abdomen is done. So I've done head and neck, chest, abdomen. I'm moving on to the extremities. And I don't really want to keep bending over, so I'm going to actually raise the bed up just a smidge. Okay. And you can put the side roll up on the side you are not on. So I'm going to first make an observation about the upper extremities. They look the same color. They look the same size. I'm going to palpate them. Do they equal temperature? Yes or no? Okay, I'm going to check my radial pulses simultaneously. I'm going to check my patient's cap refill, brisk, bilateral. Okay. I'm going to ask my patient to squeeze my hands. Squeeze, equal grasp. I'm going to pull, don't let me pull. I'm going to push, don't let me push. Equal strength bilaterally. So the arms are good. Okay. Now I'm going to move to the legs, a little bit more at the legs. Hang on just a second. You guys will be glad to be back in class and not looking at these seasick videos. Okay, so I would actually fix this wrinkly bed. So I'm going to go ahead and evaluate the legs, maintaining the patient's privacy. So I'm going to just first look at the legs. They look good. They look about the same size. And then I'm going to say, they look about the same color. I'm going to actually touch them. Okay, I'm using my wrist actually instead of my fingers. And then I'm going to take my dorsalis pedis pulses. You might notice that my arms are crossed so that my right hand is touching his and vice versa. Okay, so then dorsalis pedis pulse is strong, posterior tibial pulse is strong. Okay, and then 2+ strong and regular, all pulses. Check for edema, no edema. Brisk capillary refill. You can wear the gloves when you're doing the feet. I'm going to, well, first I'm going to have the patient, I'm going to push your feet, don't let me push. I'm going to pull your feet, don't let me pull. Now I'm going to do the Holman sign. I put my hand under their calf, briskly dorsal flex the foot. I'm checking for pain. If there's any pain, that would be indicator for a possible blood clot in the lower calf. Don't massage it or anything at that point. So the legs look good. I'm actually going to take a peek at the heels, between the toes, nothing going on there. I should have showed you what I was doing. I actually just picked it up and looked at it. So everything looks pretty good. The last thing I need to do is examine the patient's back and bottom. This requires me to roll the patient over and assess their skin. At this point, I would probably go ahead, give them a back massage, put a pillow and reposition the patient. Now, you guys cannot probably see, but the patient does have a small red area on the coccyx. So I observed that it's about the size of a quarter. I would go ahead and put a pillow and reposition the patient off of that. Okay. So my physical assessment is complete. I would ask the patient, you know, do you have any questions for me? Because I've asked you a lot of questions. And she said, no, she's doing good. I put the patient in a position of comfort, call light, then reach, bed down. Now you'll notice at the end of this competency, there's a lot of 3 points at the bottom. Everything from giving the patient water, tissue, room temperature okay, blanket, remote control, safety, bed down, call light and reach, restore, report, and record. Restore the room, pick up all your junk, report all your abnormalities, and record them. So chart it. So that's the head to toe assessment. I hope that is a help for you, and have a good day. Thank you.